Hello, my name is Jan Steele, VP of Brand Development for Allergy Med. Today we're here to answer some questions that are frequently asked by our physicians and patients. I have with me my two esteemed colleagues, Anthony Acaputo and Jose Puentes, both AllMed pharmacists. If I may, I'd like to begin with our first question. This is from a patient. I ran out of drops before the end of the month. Why weren't there enough drops in the bottle?
That's a good question. Each of our batches of allergy drops that we make have a quality control system that we have in place. We actually count the number of drops out of the batch, out of a selected number in the batch, to make sure that we have enough drops in the bottles. This here usually tends to be about 160 to 165 drops. The actual therapy is 140 drops. So therefore, there should be plenty of drops in the bottle. But even with that, some patients do not have the same type of pressure that they put on the bottle, and that they also do not administer the drops under their tongue correctly. So we have three different ways that we want to take care of that here. Number one, make sure that you squeeze the bottle with a light squeeze, that you release it after every drop, and therefore this here will make sure that the drops come out consistently. The second portion of this here is look in the mirror. So this way here that you can see the drops actually go underneath your tongue. And if you look in the mirror and you do this here, you will become more efficient in having the drops enter the cavity where we want it to be, which is under the tongue. The third thing, what should you do if you run out of drops? You should just go to the next set. Once you've used all the drops in that particular bottle, you've basically finished the course of that bottle. So therefore, you just go on to the next bottle.
Okay, my next question is from a physician. He asks, I have a patient on month 1 therapy who began to sneeze, cough, and developed a rash. What would you recommend in this case?
Well, that's actually an excellent question because this does happen from time to time with some of our patients. What we recommend is that the patient, on the current regimen they are, go back to the previous regimen. So for example, if we are currently in week 3 of month 1, then they should go back to their week 2 dosing regimen. That way, they're on the previous dosing regimen, which is slightly less allergen being exposed to the sublingual mucosa, and they should see a decrease in their symptoms. But finally, they should also, as a physician, follow their own instincts, and if they have any questions, they can always call the pharmacy.
A clinician asked, she said she's not getting an appropriate reaction on the positive and negative controls when testing patients. Why would this occur?
Well, with positive and negative controls, we always can have what they call false negatives and false positives, or false results. In the case of the negative antigen, the negative solution that we use is just basic sterile water for injection, and you should have no reaction to that. The other part is the histamine, and we use 1 milligram per mil of histamine. And this should give a significant reaction and a sort of a larger bump than you would have without the negative control. Now, why do they have a positive and a negative? Well, one of the reasons would be is that they would have something that's called contact urticaria, or they would get a hive. The hive would then be which is not an allergic reaction, it's just a touch reaction. So this is a false positive. The second part is on the histamine. We have in our daily lives things that we don't think about as being antihistamines. And two of the drugs that come to mind are Pepcid, which is famotidine, Zantac, which is ranitidine, and also the older drug Tagamet, which is cimetidine. These are what they call histamine 2 blockers. Even though they reduce the amount of acid in your stomach, acid actually is in your stomach is actually produced by histamine. So therefore, they would be taking these drugs and they would reduce the amount of the histamine reaction. There are other drugs that we have in our flyers and in our manuals that show that these drugs should not be taken. And every once in a while, someone forgets and takes their morning medication, which is contraindicated before the test. So that could be probably the main cause of why they would get a negative reaction from the positive histamine.
Here's a question I often get from both physicians and patients. What exactly is in the oral drops?
Well, what is exactly in the oral drops is a compounded mixture of glycerin and the allergens from your region. So depending on what region of the United States you live in, the panel is made for that specific region, and then we combine those allergens in a compounded product with glycerin, and that is what is actually in the oral drops.
The next question from a patient: if I decide to take the drops, when should I notice results, and how long will they last?
Well, we would expect you to start seeing some results after 6 months. Prior to 6 months, your body hasn't built up the tolerance to the allergens that are in the environment. But after 6 months, you should be seeing some relief, but not the type of relief that we would want you to see, which is probably 95 to total immunization against the allergens. So therefore, our therapy is from 1 month to 36 months, with 6 months being a start to seeing of a reduction of your allergic reaction, and an increase as the months go by. So therefore, it's a 36-month period that you would have to take that medication and to see full results.
And how long will they last after I complete the 3-year therapy?
You should have a sustained non-reactive to that particular allergen. Your body will be fine-tuned to ignore the allergen, and you will not get the allergic reaction.
Another patient question: how often do I need to see my doctor while I'm taking the oral drop therapy?
Well, what we recommend while you're on the oral drop therapy is to see your physician every quarter, so every 3 months. That way your physician can see your progress while you're on therapy, and you can see how you are reacting to the medication that you're being on. So it is very important that you continue to follow up with your physician.
Another patient question: can I switch from allergy shots to oral drops? How do I do that?
The question is very, very good. Allergy shots and allergy drops have the same outcome. The outcome is being that you are tolerant to the allergens or the allergens that are in the environment. But with allergy shots, you have to show up to the doctor on a weekly basis, and you would have to wait in the office a half an hour after you took the shot. This is very time consuming for the patient, and the patient also, sometimes they have a life and they have to move on and they miss their shots. With allergy drops, you just take them with you. Wherever you go, you can keep your therapy going, and it's all on the patient. So therefore, the answer to that question is yes, you can change, and yes, you should change. We at Allergy Med and All Med Pharmacy recommend people be on the drops, even though we do the subcutaneous therapy. So therefore, just do it as natural and take your drops, and that's where we're going to be next.
From a physician, do you recommend that I prescribe the oral drop therapy if a patient has asthma?
Well, that's a great question, Jan. Due to the fact that the patient has asthma, what we would recommend is that the patient's asthma be controlled with pharmacologic therapy before you begin the Allergy Med drops. If the patient's asthma is not controlled with pharmacologic therapy at the time of the visit, then we would not recommend starting the Allergy Med drops at that time.
The next question from a patient: I stopped taking my drops 3 months ago. Now I want to get back on them. Do I have to start over?
No. If the patient is on month 1 and 2, then we would continue on month 3, just like they would on their normal progress. If they're on month 3, 4, 5, or M, then they would go to the previous month they were on. So if they're on month M, then we would go back to month 5. And if they're on month 5, then month 4, and so forth. So no, they do not have to start over.
Good news for the patients. Should I prescribe the oral drop therapy if a patient is pregnant? Obviously, this is from a physician.
No, if a patient is currently pregnant, then we would not begin the therapy on that patient. We would wait till the patient finishes their pregnancy term. Once the pregnancy term is complete, then we would recommend beginning the Allergy Med therapy.
A patient asks, I travel a lot between the East and West Coast, but was only tested for the East Coast. What should I do?
Well, since we have different panels for different areas, what we would do is we would customize your particular drops to include the West Coast antigens. This way here that you would be covered for both areas of the United States.
This is from an RN. How old does a child have to be tested?
Well, in most of the studies that have been done in pediatric patients, the youngest age that they've actually recorded in a study in is a 3-year-old patient. So what we recommend is if you're going to be testing a child, that they be at least 3 years of age.
Thank you. This concludes our segment.